Uh, so, so, good evening, everyone. On the behalf of Dental Desk Academy, it is my pleasure to welcome Dr. Prabha Chaudhary, DDS. And ma'am, rather good morning to you. You're speaking from USA. So, how are you doing, ma'am?
Good morning. It's my pleasure to be here. I'm really good. Thank you.
Thank you, ma'am. Thank you for giving us your time. So, ma'am, can you please tell us a little about your journey? Like, where did you do your BDS from?
So I studied back in 2008 from Baba Farid University in Punjab. And after graduation from there, like 2008 to 13, I had my own practice in Ludhiana for 5 years. So around like 2018 November, I moved to USA, and then I started looking forward to buy another journey in USA.
So, ma'am, what brought this spark for going to USA in you?
Actually, nothing was planned. I was not prepared, and it was not in my mind at all. I just got married here, so I had to come.
No, but it's such a relatable answer. I can understand that, honestly. So, ma'am, what was the initial research which you put into it? I mean, you must have got quite used to being, being a practitioner in Ludhiana. How did you transition here?
So as soon as like I came to know that I'm going to get married in USA, I have actually one friend who was already dentist in USA. So I just messaged her immediately so I can get more information about the process. And she gave me some information regarding the TOEFL exam that which I could take while I'm still in India. And other than that, obviously getting my BDS degree evaluated while I'm in India, that makes the process a little bit easier uh, rather than coming to USA and then starting that process. So those are the two or three things actually: getting my degree evaluated through ECE and TOEFL exam, which I already took in India before I came to USA.
Okay. So, ma'am, can you tell us a little about TOEFL and IELTS? What are these all about?
So in USA, most of the universities take TOEFL exam, not IELTS. Like IELTS is very common in Canada and other countries, but in USA, I mean, 99% or more than that, I would say, is TOEFL exam, which universities take to basically measure the English test.
Okay. So, it's
For
an English proficiency test, ma'am. And
yes.
ma'am, how is the exam like? Like how many questions and what is the structure of the exam?
So it's similar to IELTS, like it's English proficiency test, but the format is little different. So definitely people take coaching or without coaching, but they need actually the books or practice tests so they can practice. I would say 1 or 2 months practice is good enough, similar to IELTS, which people usually take. And once it's the exams, basically I don't remember the exact number of questions for each part, but same four type of sections are there, like reading, writing, listening, and speaking. And it's an online exam, mostly on like people take on computers, and the scores are from I think out of 120. And usually because it's very competitive in USA to get into dental schools, so definitely they expect you to get more than 100 scores out of 120. And yes, and sometimes obviously students take multiple times, two or three, until they are above 100, because especially for Indian students, I have felt here it's very competitive because there are a lot of Indians who are applying to dental schools. Like if we compare with other countries, so definitely there are more Indian students. So it becomes very competitive, and it is one of the factor which definitely makes a difference. So TOEFL scores are really important, like how uh, I mean, this makes a difference, not a huge, but makes a difference, yes.
Ma'am,
So
thank you
TOEFL
so
score.
much, honestly. Because, as a child, I used to always be curious. Nobody actually gave such good clarity. So, thank you. And,
Mhm.
ma'am, now let us speak about the elephant in the room, the INDB exam, because we are so afraid of it. It is also a very expensive test. So, ma'am, can you just walk us through your journey? How was it for you? What did you do? What did you study? Everything.
So I took this exam in 2019 around March. So at that time, it was having two parts, INBD part one and part two. But now it's only integrated one part, INBD. It's not part one and part two. But I just read the format because some of my friends are still taking. So I was able to see like what kind of preparations they are doing. It's similar, but just they have made it one exam. So definitely for INBD, people usually take 2 to 3 months, obviously depending upon their like how much they remember from the BDS degree. So it's both theoretical and practical, because in Canada or in other countries I have seen like it's sometimes the exams are more clinical than theoretical, but INBD is both. I think have equal ratio for theoretical and practical part. So people usually prepare for 2 to 3 months or sometimes 6 months approximately. So that's, I think, is enough time for them to prepare for INBD. It's MCQs type exams, so you have to click, so you can, there is no negative marking, so obviously you can uh, do whatever you want to do without hesitation. So that's all about this exam. I mean, I honestly don't remember because I took it so far back, like how many questions and what is the latest format about INBD. But definitely it's available on their website, so anybody can easily check. And I didn't prepare much, but obviously because I knew Dr. Santok at that time, so I definitely connected him with a quick call that if he can help me with the exam and all that. So he sent me some material at that time. So I was because application cycle starts in March and I started preparing in January in 2019. So I was having just 2 months. So I have to finish part one and part two. So I just called him that if he can send me some material for my preparation, and he sent me for both part one and part two, and I cleared in my first attempt. I just took 1 month for my part one
Wow.
and 1 month for my part two because I wanted to apply in March cycle. So I
Oh,
had to be very quick. I mean, that was my other friend, like who were already in USA. They were not suggesting it. They were like, "Oh, it's better to pass in first attempt because for this exam, it's only pass and fail.
okay.
There is no scoring. So
Okay.
you are not concerned about scoring higher marks. You are more concerned about getting like pass scores. That's it. I think which is about above 70%. So once you have scored above 70%, you are passed. That's it. Nobody's gonna tell like you have scored 71 or 81 or 91. Doesn't matter. It's
Mm.
just you need a pass or fail.
Okay.
And after the exam, yes, and the attempt matter. Like, did you clear the exam in first attempt, second attempt, or third attempt? That matters. So in this exam, so that's why it's always advised to clear in the first attempt, because that's going to show in your result that you cleared the exam in first or in how many attempts. Like as I was mentioning about the TOEFL score, like above 100 is considered a good score. So same for the INBD exam. If you are passed in first attempt, that's considered good. So
Okay.
those are things which should be in your mind when we are taking INBD exam.
Okay. And ma'am, like when you compare this exam with the NEET exam, NEET MDS exam, which happens, so ma'am, like, can you tell us how different, or do you think like we as Indian students, we really lag behind? What can we do to cover this bridge? And what is the level of these exams, in your opinion, when you
I
compare it?
think Yes, I think NEET exam is more competitive and tougher than INBD. I don't think so. INBD is that tough exam. It's more because whoever I have seen like around me, they usually pass in first attempt. I have never, like in my contact, I have never seen anybody not clearing this exam in first attempt. So it's not that tough. But in NEET, obviously, I have seen people taking it so many times to get that desired scores. So definitely, according to me, NEET is much more competitive and tougher than INBD. So INBD is not that tough. It just need the right material. So once you have the right material and you have obviously dedicated hours, it's not like you're just reading 1 2 hours. Because if I'm saying I cleared my exam in 1 month for part one and part two, actually I was like 100% just only studying, not doing anything. So it should be like concentrated time on that particular subject. So I didn't read like all my BDS books. It was nothing like that. It was mostly like MCQs which I read. And definitely if I have any question about particular MCQ or particular subject, I just went through that subject briefly. So it was not like reading all the books again, because you don't have that much time to go through all the BDS books which you read in 4 years to read in 2 3 months.
True.
So it's basically just MCQs and going back for particular subject and question which you don't understand or don't remember.
Okay. So, ma'am, like you told, we should go back to particular subjects. So, ma'am, the clinical ones, I believe, any other subjects, like some specific
No,
ones?
theoretical, because some of them biochemistry, physiology, we don't remember because we studied that in BDS first year. So we sometimes like are not aware of those subjects. So definitely we have to go back to those, but mostly clinical, because if somebody has studied well in BDS, I think clinical subjects are always in our mind because we are practically doing that thing. So I
Correct.
feel like it's mostly theoretical, which we have to go back and kind of remember
Very
the
true, ma'am.
things.
And ma'am, how was your practical exam like? Because this is very scary as a student. And you said in Canada they place more weightage for practicals, but here it is kind of equal. So what all did you conduct during those practicals, ma'am?
So to get into dental school, we don't need a practical exam. It's only INBDE, which is a theoretical MCQs based test, right? So some universities, not all the universities, have the requirement of bench test. So that bench test is basically a clinical exam where you actually prepare class 2 cavity or a crown prep, or some schools, I know one University of Colorado which takes even the wax for the inlay and onlay and all that stuff also. So that's the only university I know here. So that's why you have to prepare for the bench test, but usually for the bench test I have seen here a lot of coaching. I'm not aware if India also has a coaching for bench test, but I took my bench test coaching here in USA only.
Okay. And ma'am, how long did it take you to, but you must have been very good at it, yeah, having done 5 years of clinical experience. I don't think it must have been a very big task for you. And ma'am, are they really particular about the cavities? Are they like really detail oriented?
Even if I have practiced back in India, but definitely it need coaching because they are very specific and detail oriented. Yes. So it definitely matters for the class 2 prep, like the box shape, everything. It should be very particular dimension and size and shape. So even for the crown prep, they are very particular about that. So I mean, even if we have studied or practiced, I think still we need that polishing
Right.
little bit so we can come to the level what they are expecting from us, because as I mentioned, it's very competitive. Even if you're very good at preparing all the crown prep and class 2, which is bread and butter for a general dentist, but still I think it needs that just polishing. I didn't take like a big course. It's just usually here it's 1 week course and then you are practicing on your own. Like you can practice at home. People usually buy a small compressor at home and they
Okay.
have mannequin and they are practicing. So I practiced at home for like obviously 1 month, but it was like I took a coaching, so at least I know what they are expecting from me.
Right.
So it's 1 week course and then practice at home for 1 month approximately on mannequin.
Okay. So, ma'am, once you have cleared this exam and you've got a good TOEFL score as well, how did you go on about shortlisting the universities which you want to apply to?
So that's actually a very wonderful question, because whenever actually somebody like call me anytime, like how do you select, because actually there are more than 40 universities in USA which accepts international students and they have international dental student program. So basically as a international student we can apply to those all 40 universities, but obviously it's very expensive to apply to one university. It costs around 300 something dollar. So nobody can like apply to 40 university, so we have to narrow down. So how do we narrow down? There are a lot of factors. Like number one is the location, like which state you want to go, because I was living in California at that time, so I wanted to apply to all the California schools. So California only have 6 dental schools.
Okay.
So I definitely wanted to apply all to six California. And I mean, that is one of the deciding factors, like which school you want to apply depending upon location, because you cannot apply everywhere in USA. You
Yes.
have to narrow down, okay, I can apply to these are the 3 4 states I want to go to. Or you have some family members or friends. I mean, that could be the priority. Or second thing is obviously the tuition, like the cost of how much you're gonna spend, because every school has different tuition fees. It's not same. So like it ranges from, I would say, obviously 200K dollar to 400 or more than 400, so 450. Some of the schools have 450K tuition fee for the whole as well, for whole 2 to 3 years program. So that was my second factor. I didn't want to apply to any school which has like above 300K tuition fees. So I narrowed down to the schools. Okay, so these are the schools I want to, and these are very expensive. I don't want to apply to those schools. I mean, multiple people's obviously they have their own reasons. Those were my reasons. So I'm just telling my own
Yes,
opinion.
ma'am. Very practical reasons.
So third reason was how many seats they have for the international students, because some schools have just 6 seats and some have like more than 20 or 30 or 40. I
Okay.
know, yes, 40s also I know. I think it's 6 to 40 mostly. So definitely, I didn't want to apply to schools who have just two,
Yes,
three, four,
seats.
five, six.
Mm.
So my criteria was, let's decide based on if they have 10 or more than 10 seats for international students, because I know in University of Iowa, or like I think in that side they have just like 3 4 seats. So my friend actually, she applied there only and she studied from there,
Oh,
but she was living in Iowa. So, as I mentioned, people prefer the same university where they are living. So, she
right.
applied there, even it was having just 3 4 seats, but she was living in Iowa, so she applied there.
Okay.
So, that makes a difference. So, definitely number of seats, location, and the tuition.
Price.
So, these
Tuition.
are the three factors. And the other fourth factor is how many years program, because it ranges from 2 to 3.5 years of program, because some have just 2 years of a IDP program, 2.5, 3, and 3.5. So definitely you how much time you want to spend, because if you are become able to become a dentist in 2 years, why would you go for 3 years or 3.5 years program? So that was my another criteria too. I mean, these are so that's how I was able to narrow down my schools. Okay, this is like no, 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 and this is yes, yes, yes. So don't mind my daughter; she will be around.
Yeah, yeah, ma'am. Not at all. It's our pleasure. Ma'am, is there any provision for scholarship for Indian students? Because 300K per year is quite exorbitant for sure.
Yes,
Okay, this
not
is
per
total.
whole, the whole
Okay,
fees I'm telling you.
okay, okay.
So there is no in actually any stipend or sponsorship or anything related to these programs specifically for international students, because these are international programs, so no funding for them. It's the only way to obviously pay that high tuition is getting student loan. So student loan is the only option, or
And
you have your
yes, yeah, that is a blessing for sure. So, ma'am, like the college you like, which university you went to? University in California only. And
yes.
ma'am, you went for a 2-year program?
So yes, my university was University of California, San Francisco. I got very lucky that I got admission in California, and it is a very good school also, UCSF. It's University of California in San
Yeah.
Francisco. And yes, it was a 2 year program. So as soon as I graduated, they started 3 year program as well. So now they have both 2 years and 3 years program. So basically, yeah, they have 20 seats for in both 2 years and 3 years program. So total 40. But definitely you see like which program, because some people, if they think like they have less chances of getting accepted, so they apply to 3 years program. If they think no, they are okay, their profile is really good, they apply to 2 years program.
Okay,
Yes.
okay. So, ma'am, so, ma'am, if someone is, say, planning to go from India, So like
Yes.
ma'am, when it comes to going to places like Dubai, we need to have a lot of certificates with us. Like there's a good character certificate which one needs to carry. So ma'am, when it comes to the US, are we supposed to cater for such documents? Like as a student, someone who is in final year, someone who's an intern, if they can start catering to these certificates, ma'am, like if you can just guide us through documents which one needs to have.
I think for applying to dental schools in USA, they definitely check your CV. So in CV, you should be having a very, obviously, CV should be very detailed, and it should have all the things you have done since you apply to the school. So in that, obviously, you mentioned about the international like CE courses, the continuing education courses you are doing either in India or in USA. They definitely more you have done in USA, it matters more than in India. But whatever you have done, you should mention in your CV like, okay, I have done my these CE courses in India, then definitely you mention those in CE. Sorry, my daughter,
No,
I have to prepare something so she can be occupied.
no issues, ma'am. It's okay.
Give me 1 minute.
Sure, ma'am.
No pressure.
Hmm.
Yes, wait.
Uh, so, ma'am, one important question which I had to ask, like once you did DDS, so ma'am, when you compare it with the clinical exposure which we get in India and the practices which we do, like how different is it in India and in US?
So, I mean, it's not a major difference. I would say, like, it's almost similar. I mean, even if I'm practicing as a dentist here, but like whatever I'm doing every day, I don't feel it's very different from what I did back in India. Like similar type of fillings we are doing, composite fillings we are doing, crown preps we are doing, extractions, or it's dentures. But overall, obviously, even if there is a established practice in India, they or in even in dental school, they always teach you all the stuff related to impressions, different new materials and x-rays and everything, so you are aware of the latest technologies. So I feel like similar here in USA, it's more like they always try to use new technologies more in dentistry rather than being sticking to the traditional stuff. So definitely that's the only thing I have seen, but other than that, it's not a major difference in the quality and the type of stuff we have done in schools or in practices in India. It's almost similar.
Okay. So, ma'am, once you were done with your DDS, and वैसे I know, ma'am, you got married here, but ma'am, let's say someone who comes, alone, then ma'am, how do they go about their visa? Because I believe with Trump now, this is a very, it's a huge task, I believe now.
Definitely, I mean, it has impacted a lot about how people were thinking about coming to USA and then pursuing their like higher education and then getting jobs. It has impacted a lot. So, but I'm not sure about obviously like how long it will stay and how the conditions are going to be. Will it be like better or no? But till like today, I have seen like obviously if somebody gets like they started applying to dental schools while they are still in India, their profile should be really strong because we were discussing about the CV, right? I think we got interrupted.
Yes. No issue.
So CV is very important because definitely whatever you have written in CV, like, okay, this is my clinical experience, clinic back in India. Like I have worked in this clinic for that many years or months. And then obviously these are the continuing education courses I have done or scientific presentations which are very important. Like if you have done some paper publications or a poster presentation, definitely you mention those things in your CV. So these are my scientific presentations I have done or paper publications I have done and experience. And other than that, the last column comes for the which is considered very like important here in USA, but back in India I didn't feel the much importance of that thing, is a volunteer experience. What does that mean? Is like you have done some charity work, doesn't matter for dental, it can be in any field. Like you have done any charity work, free volunteer service to serve people or country, those also become very accountable here, because here they want a multi-rounder person, not only sticking to the books. They
Right.
want a person who can take care of the like society as well, so they considered volunteer experience very important. And other than that, like some minor factors but still considered important, I know, because one of my classmates in UCSF, he was from Taiwan, but in his profile, which made his profile distinct, like he could speak four languages.
Okay.
So, and I mean, how I know that was important, because I just talked to one of my professors and they told it, yes, it is considered as an important factor if somebody can speak more languages, or I mean, they want a multi-rounder person when they are kind of selecting the
Hmm.
applications. Like, they want somebody who, it's not, I'm saying if somebody speaks multiple language, there is a 100% chance he or she will get selected, but definitely it makes a positive impact. Okay, that's a good point about somebody. Or somebody participates any game or
Right.
sports, that
Hmm.
also makes a good difference, from like outstanding from other applicants. So definitely those are the things which you should be mentioning in your CV. If you are good at those stuff, or you have
Hmm.
actually done things, you can definitely mention. So apart from CV, then comes the letter of recommendation. So letter of recommendation is something you take from your professors. Like, one is dean application usually, and one is like professor, and third one is from the clinical experience relevant, whatever is like any three. They don't mention from where, but usually any three letter of recommendations are taken here by the universities. And usually they prefer one should be from in, like somebody who have done something in USA or Canada, or any out, like basically out of their country, not in their domestic country basically. So that's why it makes a big difference. If somebody who is already in USA, if they have applied, they have some clinical or any relevant experience in USA, so they can write in their CV and take one letter of recommendation from here. Because you
Right.
asked about the visa questions, that's why I wanted to explain this thing first. Because
Hmm.
once you are here in USA, then only you can add these third element, like
Right.
letter of recommendation from somebody who is already present in USA. It can be any professor,
Hmm.
because these students come here like who are not married. Then it's a different scenario. Like I came as on a marriage basis, so somebody who is just applying as a student unmarried, they
Hmm.
usually apply to here like on a fellowship program, like 3 months 6 months fellowship program. Or some people come on like master in public health or those type of courses. Those are
Hmm.
2 years, because those are like obviously depends on how much you want to expand to enter to USA, right?
Right.
So
Hmm.
3 months fellowship, 6 months fellowship, or any public health program, I mean, those all are stepping stones. Those are usually not the career options. People don't assume they are their career options. Those are stepping stones so they can get into DDS.
Right.
So it depends on, and for all those courses obviously you need a student visa. So
Hmm.
you will, those courses you can apply while you're still in India, and you get I-20 form from the university once your applications get selected. And then with the help of that I-20, people usually get the student visa, come here, and then start those courses. And while they are in those courses, they work on their profile to build up to get into DDS, which is like obviously getting letter of recommendation from one of those professors, or
Hmm.
maybe making their profile like CV more detailed if they have done any continuing education or presentation or volunteer experience, or I mean any extracurricular activity they have done, they can mention in their CV while they are still in USA. Because you have to be multitasking. Obviously you can't be just, okay, I'm doing fellowship, I cannot do anything. No, you're supposed to be doing lot of things. Because even while I was preparing for my NBD exam, I was doing shadowing. Shadowing is like just observing other dentists. So I was in San Diego, so I shadowed for those 2 3 months regularly, without, because so for the whole, basically I was studying in the evening and night time. So in the daytime I was shadowing the dentist for 2 to 3 days a week, not every day, 2 to 3 days. So basically shadowing and observership is also very important. Because I mean, not all the students do this. Some people just work as a dental assistant here. So it's basically writing in your CV that you gained some experience from the people who are already practicing in USA. So either you are shadowing those dentists, like just observing, or you are working as a dental assistant with them, or at the front desk, or a receptionist, doesn't matter. But you were in that environment in the dental clinic here, and you saw some of those work. So that also make a good impact. Okay, oh, so you have done two, because I know most of my classmates, like, or whoever, like, who are working with me, dentists, they had worked as a dental assistant for few years in USA before they actually got into dental school. So
Okay.
everybody has their own journey. Nobody has the same
You can't
experience, because
copy.
no, you cannot. Everyone has their own journey to show the, obviously, the professor, okay, that is my application, and I have done this, did this back in India, back in USA or Canada or any country, and this is my profile. Because, and even in my schools, we were 20 students in UCSF. None of us have the similar journey. Everybody has done different things, and that's what makes a difference, because they don't like just take all the people who have similar profile. So don't copy, okay, he or she did this thing, I should also do, and I will get into school. No,
Right.
everybody has their own way to show their journey. It should be unique, a good journey and a good experience to show them, okay, I have done this, and okay. And if they like, it's more like I mean, presenting yourself or selling yourself, that okay, I am the right candidate for your school.
It is such a
So
holistic experience. I mean, listening to you, my God, mind, very nice, very nice. So, ma'am,
okay.
one thing which I wanted to ask you, once you were done with DDS, how did you go about, which career to go to? Like, are there corporate chains in US, or are you owning a private clinic at the moment, or are they government jobs? How does it go about then?
Yes, so this is also a very good question. So, because there are, yes, multiple options. Like either there is a fourth option too. Like either you can go for your master degree, because after you done with DDS, some people obviously want to do the residency program, like speciality.
Right.
And if somebody doesn't want to do any residency program, just want to work, because obviously everybody has to pay their student loans. So these are the three good options. Like either you work in a private practice, like somebody owning a private practice, you can work as an associate dentist there. And yes, in USA there are a lot of corporate chains. What does that mean? Like a one company having like 50 or 100 clinics in the USA, in particular state or in different states. So you can work for those corporate chains as well. Or third option is the government jobs. Those are called FQHC here, the government owned clinics. And yes, you can work for those as well. So usually, and the fourth option, which is an owning your own practice, private practice, for that obviously you need more experience, I feel like, and funds. So usually after 1 or 2 or 3 years, people prefer to have their own practice rather than immediately jumping to have their own practice. I mean, there might be some people, but in my experience, I have not seen much dentists opening their practice immediately. They usually gain some experience by working as an associate, maybe 1, 2, 3, 4 years. And once they feel confident and they know more about the system here, they they become familiar, and then they own their practice. And uh, and the other factor, obviously, the visa, because rules, you are on your student visa while you are in the school, so we get a 1 year extension to work here after the DDS. Like in engineering, usually they get 3 or more around that time period, but for dentists it's only 1 year of OPT, like occupational practical training period, 1 year. So we have that. So usually we have to secure work visa after that. I mean, if you are already a green card or a citizen here, then these are not the problems, the work, the visa or anything. But if you are on student visa, you definitely need a work visa after that, because you have just 1 year of OPT, and within that 1 year, you should get a work visa. So usually people prefer to join a clinic or a company like corporate, who can sponsor them that work visa. So you have to ask them, can you sponsor me work visa? And usually they are okay with that. They sponsor you. That's not so. And corporates are more readily available to sponsor than private clinics, because some private clinic is like a small business, but corporate is
Mm.
like a bigger business. So bigger
Chain.
business, yes. So they know more about this visa system, and they have done lot of visas in the past, so they are acquainted with this situation already. But in private practices, it depends on the owner, like how comfortable he or she is to sponsor you. Sometimes they are, sometimes they are not that comfortable. So they are
Mm.
like, you are not green card or citizen, or you don't have work visa, sorry, we cannot hire you. So they usually, like, they depend on their experience and how much they know about this visa rules and all.
Right.
Usually they have attorney, but still some people don't want to think about, like, right now I feel like because of the visa rules and regulation, private clinic especially, like, few of them might not be interested in sponsoring your work visa because they don't want to be in any trouble. They
Right.
prefer somebody who's already green card or a citizen, so they are not in trouble. But corporates, usually they sponsor. Right now I'm working for a corporate and they sponsored me H1B visa, work visa, and I'm right now on work visa, yes.
Okay, ma'am. Okay. This is very, very, again, informative, very insightful. And ma'am, final question, how satisfied are you with the work-life balance? Because you've actually worked in India, you've seen both sides of the coin. So what are your thoughts?
I mean, honestly speaking, I love dentistry. Back in India, also, when I was working as a dentist, I loved it. I was enjoying whatever I was doing. I mean, definitely, I was earning less money there, I feel like.
Right.
But here, I mean, if you love something, feel like whatever the timing is, you feel happy. So right now, I'm actually. So yes, I am very content that I'm working as a dentist in USA. I mean, it's not only like, definitely monetary is the one difference than working in India, but I know some dentists, while they are still working in India, they make really good money. And work-life balance, I mean, obviously it's a 5 days job, Monday to Friday, 9 to 5 p.m. You're working, and sometimes it can extend depending upon obviously the patients. And so it's more on like on a dentist, because I know some people are working just 4 days a week or 3 days a week instead of working all 6 days, like, and some are working 6 days a week as well. So it depends on, like, individual, like how they want to work and how much they want to work, and basically make money, and balance their life also, because obviously you, there is no limit like how much you want to work. But definitely anybody who is working in USA, because here is no much help even at home or outside, so definitely you have to balance your work life here, so you don't overdo and then get frustrated with the work. So definitely I try to keep a nice balance between my work and life, so I get the time to do exercise, go out, chill with my friends. It's not only that I'm just working every time and day. So maintaining a good balance is something I would say definitely important whenever you're working, either in India or in USA, so you can focus on your own health as well.
Yes, that is so well put, ma'am, and truly an honor having you. Because I swear to God, I swear to God, I wish I could have watched you speaking when I was a student. Because the way you explained everything with the level of clarity, it's a very inspiring journey, and so much to learn from you, ma'am. Truly, thank you.
Thank you so much. Thank you so much. I feel happy that I can be of help for somebody.
No, ma'am, for sure. I'm sure if students look at this video, it'll come up into their mind to, really consider US as an option and rather, live a good, fulfilling life as well. So, ma'am, thank you so
Yes.
much for,
Thank you.
giving us your time today. And it was a pleasure having you on the behalf of Dental Desk Academy. So, thank you, ma'am. Have a great day.
You too.
Thank you.
Thank you. Bye.
Right. Good day.
You too. Bye.
Bye, ma'am.